Valley fever is an infection caused by the fungus coccidioides. The scientific name for valley fever is coccidioidomycosis, and it is sometimes called San Joaquin valley fever or desert rheumatism. The term valley fever usually refers to coccidioides infections of the lungs, but the infection can spread to other parts of the body in severe cases. The fungus is known to live in the soil in the southwestern United States and parts of Mexico and Central and South America. The fungus was also recently found in south central Washington. People can get valley fever by breathing in the microscopic fungal spores from the air in these areas. The fungus that causes valley fever grows in the dirt and soil. Fungus spores get into the air when the dirt and dust are stirred up by the wind or from digging. In the San Joaquin Valley and Stanislaus County areas, this is especially true due to the amount of farming that happens in this area. People and animals breathe in the fungus spores from the dust in the air, and the fungus infects the lungs, but it can spread to other organs. The fungus coccidioides grows in soil in areas of low rainfall, high summer temperatures, and moderate winter temperatures, such as the southwestern United States and northern Mexico, specifically in the San Joaquin and Central Valleys of California, southern Arizona, especially in Phoenix and Tucson, southern Nevada, New Mexico, and western Texas, especially El Paso, east central Utah, and southeastern Washington, which was recently found. This map shows the approximate areas where we know or suspect the fungus that causes valley fever lives. These are considered endemic areas for coccidioides, the fungus that causes valley fever. Much of what is known about where the fungus lives in the southwestern United States is based on skin testing studies performed in the late 1940s and early 1950s. Here we see the average incidence of valley fever in California. This map shows the average incidence of reported valley fever per 100,000 people by county during 2011 through 2017. The population of San Joaquin County is currently 789,410. According to a study published this year by UC Berkeley Public Health, rates in northern San Joaquin Valley counties are 15 times higher than they were 2 decades ago. Valley fever varies geographically with the highest case rates in the southern San Joaquin Valley, but the highest increase in cases has occurred in the northern San Joaquin Valley and the Central Coast. The incidence of valley fever has increased substantially in the last 2 decades from less than 3 cases per 100,000 people in the year 2000 to nearly 19 cases per 100,000 people in 2018, which represents an over 8-fold increase. The increase in prevalence is likely related to changing precipitation and temperature patterns in our climate. Climate change is driving cycles of more intense drought followed by intense precipitation, which appears to increase the fungus that causes valley fever.
Risk factors for valley fever include age, if you're 60 years or older, having a weakened immune system, for example, if you have HIV or AIDS, or have had an organ transplant, or take immunosuppressant medication. Other risk factors include if you're pregnant, have diabetes, or have environmental exposures. For example, if you live somewhere where the fungus is common, if you spend a lot of time outdoors, or if you work outside a lot, such as in agriculture, construction, or in the military. And for reasons unknown, people of Filipino and African heritage are at a higher risk for developing valley fever.
So how is valley fever transmitted? So as we learned in previous slides, coccidioid spores are in the soil and they circulate into the air and are inhaled into the lungs. And once the coccidioid spores are in the body, the temperature of the body allows the spores to change shape and release endospores, which are essentially smaller fragments of the spores, which can spread within the lungs and potentially the rest of the body. So the signs and symptoms of valley fever are very closely related to flu-like symptoms. So acute signs and symptoms occur within 1 to 3 weeks of exposure, and these include fever, cough, chills, headache, night sweats. You can have shortness of breath, joint pain and swelling, muscle soreness, as well as a rash. And I've also included a picture here that depicts the signs and symptoms that you can have when you have an acute illness. So chronic signs and symptoms of valley fever occur when the infection is not addressed or fully resolved, and this means that the infection is lingering on for long periods of time. And some of the symptoms include weight loss, you can have a low-grade fever, chest pain, cough, nodules in the lungs, which are depicted in this picture, as well as blood-tinged sputum. So if you are having these symptoms, it is important to contact your doctor to receive care immediately. When the infection spreads throughout the rest of the body, this is called disseminated valley fever. The infection spreads to the bones, liver, skin, spine, brain, and heart. And some of the symptoms that are included are meningitis, painful and swollen joints, painful lesions, nodules, ulcers, and skin lesions. You do still have acute symptoms such as shortness of breath, fever, headache, but this just becomes a multi-organ infection.
Valley fever may be difficult to diagnose because of the vague symptoms. Your healthcare provider will review your medical history and symptoms. They may order a chest x-ray to rule out pneumonia. To confirm valley fever, your doctor may order a blood test to check for antibodies, or a sputum culture, which is phlegm that you cough up, to look for the coccidioides organisms. There are no over-the-counter medications to treat valley fever, but for many people, valley fever will go away on its own within a few months with bed rest and drinking lots of fluids. But if your symptoms don't go away or get worse, or if you're at risk for developing complications, your doctor may prescribe an antifungal medication, such as fluconazole, and treatment can last 3 to 6 months. Some severe cases may require hospitalization.
Let's briefly discuss prevention. Avoiding dust outside in areas where valley fever is common is crucial. When it's windy outside and the air is dusty, especially if there's a dust storm, this means that you're going to want to stay indoors and keep your windows and doors closed. This also comes into effect if you're driving through an area where valley fever is high. You're going to want to keep your windows up, and you're going to want to utilize the recirculating air button in your vehicle if it's available. If you're a member of one of the high-risk groups, you should think about avoiding outdoor activities like yard work and digging that involve close contact with the dirt and dust. And then to help prevent dusty open spaces, you're going to want to cover soil areas near your home with grass or plants or other ground coverings. And then you can also wet down the soil to help reduce dust when you have to dig or stir up dust in areas where valley fever is common. So once you're finished stirring up the dust, you're going to want to make sure that you change your clothes. And then you're going to want to make sure that you don't shake out the clothing so you're not breathing in that dust. And then if somebody else is going to be washing your clothes, make sure that you warn them before they handle them. And then lastly, you can consider wearing an N95 or a respirator if you're unable to avoid being in dusty environments outside, such as with construction workers or people that are at excavation sites, or even if you're having to do some digging outside yourself. This will help protect you against breathing in that dust that can cause valley fever. Patient education. This is one of the most important jobs of nurses, is to make sure our patients are educated. So, am I contagious? No, you are not contagious with valley fever, so you can't pass the infection on to somebody else. Do you have to stay at home? No, you don't have to stay at home. However, your provider will probably suggest you staying at home so that your body can rest and heal from the infection. Will I recover? Most people who have valley fever will make a full recovery, but there are a small percentage of people who do develop long-term lung infections that can take several years to get better. And in very severe cases of valley fever, the nervous system can be affected and there may be long-term damage, but this is very rare. And then one of the most important things that patients want to know is, when do I seek medical advice? So if you are over 60, you have a weakened immune system, you're pregnant, or you are of Filipino or African heritage, and you develop the signs and symptoms of valley fever, especially if you live or have traveled to an area where this disease is common, you're going to want to contact your provider and let them know. Lastly, let's talk about community resources. So there is the Cal-OSHA website that you can utilize as an employee or an employer, and it gives the regulations that need to happen if you are working in an area that's prevalent for valley fever. And then they also have an area on the website that you can file a workplace safety complaint if you have any concerns. Next is the Valley Fever Institute. This is a website that can be utilized online. They have educational information, and then they also have a link for a Zoom support group that meets once a month on the first Wednesday of every month from 5 to 6 p.m. So you can connect with other people who are going through some of the same issues that you are. Next, you have the Public Health Services of San Joaquin County, and this has a lot of educational information on it as well. And then they also have some pamphlets and handouts that you can print out in regards to prevention on job sites. So you can bring this to your employer, or if you're an employer, you can print these off and you can bring them to make sure that your employees are educated in regards to valley fever. So we hope that you found this information in regards to valley fever helpful, and we want to thank you for listening to our presentation.